This hospital is a special place, and we are celebrating a special time. But the feeling I get working here at Mercy Philadelphia Hospital is that I get to treat our community, a community that I was raised in, as VIP. I mean, every day we get a chance to serve our community, and the mission is based on service and community. So it's just a great match for me.
I think the role of this hospital in the community is to be a comforting, healing presence of God in the lives of the people who come here. I think this hospital has a special mission because it works with people who many hospitals are not interested in serving. But I find the people here the most enlivening, enriching people. I never walk into this hospital without being greeted every single time I come here.
I think everyone would agree that Mercy's history has changed over the last 100 years, and all for the better. So some people have very fond memories of the past and others not so fond. But for those not so fond, I would say give it another chance, because you will be impressed. You'll be impressed by the technology, you'll be impressed by the staff, the care, and not just the people who work here, but even the patients who come here for the first time, not knowing the history of Mercy, are also impressed. Especially when they think of the university-type setting hospitals that neighbor us.
The hardest thing for me to ever do was to tell my 3 little children, Mommy is sick. They are the best kids in the world. They were teenagers. I saw them trying to hold back their cry. My youngest one said, Mom, can I give you a glass of water? To me, that was an endearing moment, but they looked there, and I tried to explain Mommy's going to do everything she can to make herself better, because I need to be here for you. And I think my kids need their mommy, and guess what? Here I am 20 and a half years later, 6 grand and 1 great grand. So I feel blessed, and I thank the doctors, the nurses, the technicians, and all the people who gave me the care when I was going through that very difficult time in my life.
My brother and sister and I were all born here, and who would have ever thought that we were, and they all worked here at some point also, and so did my mom. My grandmother was here opening day. She didn't work here, but she was here in 1918 opening day. We had the picture, and I brought it in because I found it along with my mom's things. I thought, this is really neat.
You could have asked for better doctors than the doctors that I had here at Mercy. You know, you have to have that bedside manner. I really loved the service that I received. Everybody was just really nice. And you really need that when you're going through something as horrific as cancer.
I have been the fundraiser for the auxiliary, and our biggest fundraisers was The Price is Right. The role of the auxiliary is to help raise money for the community and emergencies and those that may have hard times and they can't afford certain things.
Every community hospital exists because of the people surrounding it. So our reason for existence is to provide high quality care to our friends and neighbors in this community. So we serve many functions. We serve as the front door for many people who couldn't get health care from their primary care physicians, as in our emergency room. We also a major source of employment to people in this community. We also provide a social nexus. There are senior meal programs and other social outlets for people to come and interact. So in addition to being a healthcare provider, we also are an employer. We also are a social network organization, and to some extent too a religious for people who want to come to our chapel.
We provide rides home if patients can't get home. There's a Mercy van. There's cab vouchers. That's if someone's stuck and the family can't come pick them up. We have clothing donations, so if someone doesn't have clothes, we get clothes out of the donation. Sometimes if a patient doesn't have insurance, they get medicines ordered. Sunray will drop them off and we give them to the patient so that they can have it when they go home.
I live in the neighborhood and this is my hospital. My doctors are here. I come for my exams. I come for my tests. Everything that has to do with me medically, I do right here at this hospital. Or if I don't, then I'll go to the community outreach. That's another part of the hospital, especially when it's time for me to get a flu shot, I'll go there and get my flu shot. They've kept me alive for 84, and in 2 more months, I'm going to be 85. So.
My mom worked here for years before I started here, so I feel like I've really grown up here. I've grown here physically and professionally, so that's longevity, I guess, keeps me here. And the sense of family, like walking in here, it's like it's coming home.
I started working here in 1969. I was in high school, and I came up here and I interviewed for a job, and I was a little junior nursing assistant. And then I've been here ever since. So I'm here 47 years, and I still enjoy coming to work every day.
Our whole mission is to respect the people that we serve, and I really found that the gospel message of Catherine was lived out in such a beautiful family way here at Mercy. We always called it Misericordia. And during that time, from 1970 to 86, I found that there's some real partnering with the community. I found that we developed the community outreach department to go out to look at the healthcare needs of the community. I saw the sponsoring of the spiritual groups of all the spiritual leaders in all the churches nearby, invitations of schools and civic leaders, so that it really became a hospital of the neighborhood. And it was just an exciting, delightful place to come to every day. Loved it.
Mercy is a survivor. It's here to stay. It's been here 100 years. I think it's going to be here another 100 years. It's been through an impressive history, not just technologically, but also financially. And I think people are going to be excited to see what comes forward. We may just surprise everyone as to how close we get to the ranking of those university hospitals. This little community hospital has a lot of power within it that is only just, I think, being realized.
I came here when Mercy was a young 70-year-old hospital, and I was 100 years old, so it tells me Mercy and I have aged together, and we both look quite graceful, I must say. But over the next 100 years, I'm willing to commit to certain things. I think we here in West Philadelphia and Mercy Hospitals are here committed to providing high quality, compassionate care for the people of West Philadelphia and Southwest Philadelphia for the next 100 years. I bet you in 2021-18, we'll be right in the corner of 54th and Cedar, providing high quality care like we do